Great. Well, we're here to talk about sports physicals.
Yes, sports physicals.
Yeehaw, sports. Getting ready to get in. Just got a email from our new football coach. Football camp's going to be the 17th.
That's right. Yep.
That means, guys, if you want to be playing some football and you're in high school, you're going to need to get that physical.
Yes, you do. It is required in order to play.
Now Michigan does every 2 years.
Every 2 years,
right.
Yes.
You must have one every 2 years.
Yes.
But usually in these conversations, Sam, I don't know what your feeling is, but I know when I was an athlete, I wanted a physical every year.
Yes, and typically, like, 1 year we can do a well child, as in we go over, everything, and then the next year we would do the sports physical or vice versa.
Mm-hmm.
And the sports physical just focuses on that MSHA form. A full, complete physical is done. Any concerns are addressed, all of that. So, yes, we do sports physicals every 2 years for people who are playing sports, but physicals are recommended yearly.
And one of the things when we talk about physicals is we'll say patient, the athlete needs to be honest with the doctor or nurse practitioner. You've got to tell them the truth. If you've got an ankle issue, if you've got a knee issue, elbow, shoulder, if something has been amiss and you say, it's just a little pain right here.
Yeah.
So I'm not worried about it. You need to be worried about it, don't you?
Yes, you do. And concussions are a big thing with MSHA. So if you've had a concussion in the past, they want to know. And typically, if you do get a concussion, that's typically you're going to see that with football. Mm-hmm. There is actually an extra form that has to be filled out for MSHA in order for them to return to sports.
So do they have do you guys do a baseline for that concussion protocol?
Yeah, typically if most of them end up in the ER. Mm-hmm. Some of them do come out to the clinic, which is obviously preferred usually, but ER is sometimes the closest, quickest thing that needs, if it's a Friday night.
Right, if you get your bell rung, you definitely want to get checked out.
You definitely want to get checked out. But so they would be seen in the ER for said concussion. And then they would need to follow up with their primary care provider. If they don't have one, they need to establish, because like I said, it's required by MSHA to have a form filled out that they are approved to go back to play.
A lot different than it used to be many years ago. Like you said, you used to get your bell rung, and they'd look at you and make sure that you could focus your eyes, and you're good.
And you're right back in the game.
Yep. In there. A lot different than it used to be. But it's very important, though, for these athletes to not only tell their nurse practitioner or doctor that these are ailments, but they also need to be telling them if you ask a question like what supplements are you taking or anything like that, because they really need to know, especially if you've all of a sudden you check them out and their blood pressure is just going crazy.
Absolutely.
Are you taking something? You need to know, right?
Yes, 100%. And actually on the MSHA forms, it asks about cigarette use, alcohol use, and like steroid use. So those are all questions I get asked during the sports physical, just because those are important things to know.
But you do take a blood test, and you can find those things out if they lied to you.
Hey, yeah, unfortunately, yes, that's a thing.
But a blood test is required for a physical.
Not a sports physical.
Okay, just the regular sports physical.
Yep, just a regular sports physical is just like a full head-to-toe assessment, checking their pupil reaction, checking their hips. So basically, they'll have to squat down and walk like a duck. Everybody looks at me crazy when I say that. Mm-hmm. So then I have to show them. No, it's funny, though. And then they have to do a eye exam, so we have to check their sight. Mm-hmm. But as far as like blood work, we don't have to do that.
But in a regular physical, you would.
Yes. And typically that's going to be like your older teenagers that you start that. Unless you have other concerns, then obviously you would start doing blood tests as well.
When I played college hockey, when we had to go through a physical, you went through an EKG. You went through a blood test. You went through a urine test. You did, I guess, coordination tests.
Yep.
It was a full onset physical. They scraped cells off your skin to make sure you didn't have skin cancer, and that was back in the 70s.
Wow.
Because and I asked why you were doing that. They said, well, if you've got skin cancer somewhere in the middle of the season because you're playing ice hockey, it's cold, but you get extraordinarily hot. You're in a lot of equipment. That sweat can infect your skin.
Yep.
And we actually had a guy that skin did get infected, and it was just split. Somebody hit his arm, it was just split, and blood just gush out. And it was not pretty,
Yeah.
but... And he actually had to sit out the whole year because they had to treat that and had to have him go through some specialists and get that taken care of. And I've never seen anything like that, but he smoked, he drank, he didn't follow the doctor's instructions that they were giving him the right medication and creams to put on there to get it to heal, and he just didn't do it. And, it's a shame because he was a very good athlete. He ended up losing everything in his career. Couldn't play after 2 more years because he just couldn't get that to heal.
That's crazy.
Yeah.
Yeah.
And it was just bad news. And so, you just never know. But you want to be sure if you've and really when we talk about the athlete being honest with the doctor, if you are short of breath, you go obviously if you're going to run 50 sprints, you're going to be short of breath.
Right. That's actually a question as well. If they get short of breath, more than your normal exercising shortness of breath, like basically they can't breathe. That's a question. Asthma's a question because that's, some kids have exercise-induced asthma.
Right.
So that's an important question that they want to know. And then also like history of cardiac disease, heart attacks in family members that are 35 or younger because that can be hereditary.
Sure.
And then obviously if they've ever had like heart surgery or anything, they have to have clearance by the cardiologist to even play sports.
Sure.
So
Yeah, especially like I remember people have a pinhole in their heart. And a lot of times they wouldn't let them play, and then some doctors would say, well, it's not gonna do anything more.
Right.
So
Right.
just let them go ahead and play. But they would have to have that note from a cardiologist. You also want to remind people about diabetes. If they have diabetes, they really need to let their physician know as well,
Yes,
because that
absolutely.
makes a big deal when you're playing sports.
Yes. And typically if, kiddos are going to have like type 1 diabetes, which is, in my opinion, worse than type 2 diabetes because they're so what we call brittle. So they can be super low blood sugar, they can be super high blood sugar, but the symptoms are crazy. And then you add exercise into that and they need extra snacks because that can reduce their blood sugar. So it is very important for us to know all of that information.
Right. I played hockey with a guy with type 1 diabetes. They always had a Coke can and a candy bar there.
Yep.
Because it would hit him immediately.
Yep.
He looked totally different. Guy looked super healthy, and next thing you know, he's getting pale. He's running down. You can just see it, just lethargic.
Yeah.
In seconds.
It's insane.
Yeah.
Yeah.
So, it was pretty amazing. And, of course, like I said, if you don't know these things, how does the team react to that?
Right,
The
right.
coach doesn't know you have that, so you have to get that done in the physical form. Is anything else that some athletes or parents should be telling the doctor or nurse practitioner, saying, look, my son did this when he was young to his ankle or something like that, that maybe the child doesn't even remember, but it may affect the way they run or may affect their balance or something of that nature. They should be very open and honest with the nurse practitioner or doctor too, shouldn't they?
Absolutely. Yes. So we want to know all of that information. Now, say they broke their ankle when they were 4 or whatever, and they don't have any issues with it now, then that's fine. It's just important for us to know, just in case future activities were to happen and they were to hurt that ankle again or something.
Right.
So
obviously physicals at the clinic, is there a cost?
So physicals are $10 all year round.
All year round?
They can come in anytime. Just call. They can walk in out there, actually, and they'll get you in with the provider has the quickest opening, or you can call 729-8000 to schedule an appointment to get your sports physical done. I know that most sports are already ongoing, like practices, weight training, all of that's already ongoing. So,
but their camps usually are starting now. So
yeah. So football camp's coming up. But it is very important to have those done because they won't let you, once they get to a certain point, and I don't know what date it is or when it is, but they won't let you play without a sports physical.
I'm sure Misha has it on their website.
Yeah.
If you really want to go read it.
Or your coach will tell you.
Or your coach will tell you, but
Yes.
you can contact Clay Moody, athletic director, and he can pretty well let you know as well.
Right.
But it's very important you get that physical done. And a quick reminder, if it's a minor, you must have a guardian or parent with you.
Correct. Yep. A parent will have to be present.
So it had to be if they're 18, they're good on their own.
Yep.
If
Absolutely.
they're 17, bring mom, dad, or grandpa or grandma or somebody who's definitely a caretaker can sign for you because you are a minor.
Yep.
Very important to do that. So we don't want any 16-year-olds driving out to the clinic saying, I'm here for my physical. Well, can't do it.
Exactly.
So we want to make sure everybody knows that. I always thought it's better to make the appointment because that way if you walk in, you just never know who else is walking in with something maybe a little more serious.
Right.
And it's not the emergency room, but still, if somebody really has a really bad something, more than likely when they walk in, they're probably going to try and get them in quicker.
Yep.
And I don't blame them.
Yes.
Somebody has an issue. So make that appointment, 729-8000, SMDH Clinic, SMH Clinic, call it whatever you will. Still, both of them still work.
Right.
And it is in the building, Physician's Office, Building 3.
Yes.
So all they got to do is come and cough a little bit.
That's more for my DOT physicals, not the sports physicals.
No, well, it used to be part of the sports physicals.
It did
too.
used to be, and they don't require that anymore.
I know. That's. I always remember that cough. Well, okay, sure, why not? But times have changed, but they're trying to do this, and they are a lot more thorough, Sam. I'll say it because they ask a lot more questions, I think, than they used to. I'm not, maybe the tests and stuff are about the same, but a lot more thorough with the background information.
Yes, they are very, very detailed, especially with the health history portion that the parents fill out. They are I think there's at least 50 questions on that. And I mean, it breaks it down into each body system, basically. So.
Well, while we're here, though, I want to talk about physicals just for the average everyday person, too, because if you haven't had one, it would be good for you to get one.
Yes, absolutely.
Because it's giving you a nice snapshot of where you stand with your health today.
Correct. And insurance will cover a wellness visit, so a yearly physical we call wellness visits.
Right.
Insurance will cover them 100%. And that basically covers your blood work. We can order, if you're 50 or older, a colonoscopy, mammograms for women 40 and older, woman exams, obviously starting at age 21 and up. So we discuss all of that in a wellness, and it's really important to stay on top of those things, especially if there's a family history of something.
I highly recommend, and no, it's not $10, it's free. So when you talk about that annual wellness, it's even better than the sports physical.
Right. Free with insurance, because insurance will cover for it.
But even if you don't have insurance, if you want to know where you stand with your health, a physical is really the best way to take a one-day snapshot of where you are.
Absolutely. And if you don't have insurance, that doesn't mean you don't have to, that you can't come see us.
Sure.
You can still come see us, and you can set yourself up with a payment plan with our financial service department and go from there.
Absolutely. Don't take your health for granted. You don't get it back.
That is 100% true.
Yeah. So, and what you may not think is much of anything, and I know we all think we're superheroes. We can go through anything.
We
can
would
go
like
through
to be,
well,
right?
wouldn't that be great? We all think we can fight through things, and I
Right.
guess that might be the appropriate terms to use. But that's not necessarily the case. Some things you obviously, like a cold, you can battle off. But boy, if you got a torn meniscus, or you've got a torn labrum, or you've got a rotator cuff problem, they don't heal properly. I know I've got a rotator cuff problem that I did not have anything done to. There's scar tissue there, and when you do
Yep.
it just right, you rip that scar tissue because it didn't heal correctly.
Yep.
And you say, I'll take care of it later. Well, it gets worse later,
Yep.
doesn't it?
Sure does. Yeah.
So it makes it a little bit more difficult to repair that properly. And then after you do get it done, you're going to have to go through some physical therapy to get the full range of motion back again.
Yep. Yep.
Never easy, is it?
It's not.
But if you address your injuries or problems immediately when you first notice them, it's a lot better chance of getting back quicker.
Yes, absolutely.
Yeah. Now, some of us just get a little hard-headed.
No, no way.
No? Sam. Wow, that's great. Well, anyway, we appreciate all you guys do out there. And again, 729-8000 is the number to the clinic. If you'd like to set up an appointment for your child to get that sports physical, now's a great time to do it. Get it done. As we mentioned, football camp will start on Monday. They must have their physical by Tuesday. So I do know that. It's on his form. I do know that. So that I do know. And Coach Myers will be more than happy to talk to your child about different things. And, of course, make sure mom or dad or somebody or a guardian can go with them to get that physical. It's very important if they're a minor. Can't go on their own. And, of course, too, don't forget to write every single thing down or know every single thing you need to talk to your nurse practitioner about or doctor. Don't try and leave anything out and just say, you get all the way out after the physical. Oh, yeah, I forgot to tell them about that big pain in my lower back. Well, not doing you any good now.
Right.
And you got to go back in and just get some attention to that. Don't put it off.
Yep.
Just get everything out there in the open. You're going to find out that maybe it's better than you thought it was.
Right. And if you have questions about when your last sports physical was, you should be able to talk to the coach and find that out and see if you're up to date or if you need a new one.
Yeah. Very good.
So.
Very good. If they have any questions, Sam, can they call you?
Absolutely.
729-8000. Do you have an extension? They've got new ones, I know.
Yeah, we have new ones, and I cannot remember mine yet.
Ask for Sam Welch, and they'll get you to her.
Absolutely.
And, they'll get you to her. But, yeah, I know. Who was I talking to last week? I said, it was Deb Hobson. She goes, no, wait, it's 3,500. She goes, I got an easy one.
Mine is not that easy,
Yeah,
so I don't remember it.
Yeah, I said, how did you get that one? I got pulled.
Yeah.
Yeah, she's great. She's fun to be around. All right,
is.
very good. Sam, again, thank you very much. Those sports physicals, get them taken care of ASAP. This week, it'd be preferred, but next week, if you still have to get it done.
Even if you play winter or spring sports, get them done before last minute.
Oh, yeah.
Because it takes a lot of stress off of you if you get them done now instead of the week before it needs to be.
Well, Salem has moved softball to the spring season, so that takes a little less pressure off.
Yeah.
Yeah, so you do have still volleyball and football.
Volleyball,
and
football,
cross country.
Yep.
So
And then basketball's in the winter.
Yeah, I know. I mean, like immediate right now.
Right,
If you don't have it
right.
done, you need to get it done
Right.
because the camps are right there waiting for you. And before you know it, school will be back in session.
Yeah, a month.
Ouch.
Isn't that crazy?
Ouch.
Also, MISHA now requires anybody in marching band and the flag teams to get sports physicals. So, marching band and
Do they do the cheerleaders too?
oh yeah,
Yeah.
cheerleaders, but marching band and the flag teams are the newest things that they have added.
Okay. Yeah. I
So-
thought the cheerleaders were in there as well.
Yep.
They continue to add new people.
Yeah.
Pretty soon it'll be FFA and 4-H.
I wouldn't be surprised.
No, I wouldn't be surprised at all.
I was surprised by marching band, I was like, really? That's
Now,
interesting.
I actually can see
But-
marching. You know, when they go to competitions, they're
Right.
there all day.
Right.
You know, yeah, I
It
can
makes
see
sense,
that.
but I was like, oh, okay.
You know, you think of marching band like, hey, your football game at 12 minutes at halftime. No, they're practicing all the time, and they're doing
Right.
these routines. Yeah, there's a lot of work in a marching band, and we
Yeah.
tip our cap.
Until they go to competitions,
Absolutely.
and then it's a lot more
oh,
work.
yeah, it's one after another after another. Oh,
Yep.
gosh, that's crazy. But anyway, I want to tip our cap to all the athletes, all those who want to be athletes, all those who've been athletes.
Correct.
And also all of our wonderful people that we have that guide them and coach them into the way they're going too. So, yeah, cross country, volleyball, football, it'll all be here. Marching band will be here. Flag corps will be here.
Yep.
Cheerleading will be here. It's all coming. It's all coming real quick. So get those physicals in. And again, if you have questions or like to make that appointment, call 729-8000. They can give you all the details about getting your child's physical, whether it be a sports physical or full physical or your wellness check as well.
Yep.
Very important, very important. Sam, thank you.
Thank you.
You have a fantastic day. Sam's back after vacation. She's reared up and ready to go. Tell you what. Thank you, Sam. Appreciate it.
You're
We'll be
welcome.
right back with